clinics.
Gentlemen, what do you think about the quality of the technology that these different clinics were employing compared to your combined experience up here in the U.S. of over 70 years as dental surgeons?
Well, I think what's really important for people to understand that we have a global dental community now. And what that means is that dentists in Mexico are attending the same meetings and reading the same journals as the dentists here in the United States. And one finding that was actually astonishing to us is that there's one of the clinics that we've chosen that has a state-of-the-art audio-visual facility, and that dentists from the United States are actually traveling down to their clinic to attend continuing education courses. So
they have excellent equipment, just like in the U.S. In fact, state-of-the-art. In one of the clinics we visited, the dentist introduced us to a couple of new materials that I really hadn't heard of. Mm-hmm. And he said they're not even in the United States, which is probably why I didn't hear of them. But he talked about the qualities of that material from Europe, which are really good. In fact, Steve and I will be going to some conferences in Mexico because their training is good. They're up to date. The equipment is excellent. They have 3D cameras, and they bring in specialists for whatever needs to be done. Very impressed with their...
That was one, I just wanted to add one interesting thing we found is that we know in the United States, if you see a dentist and you need to have a root canal, you have to see another specialist and time is delayed. And whereas in these offices, if you need, let's say, to have some periodontal work or some root canal treatment, they actually, in several of these clinics, bring the specialist right into the facility.
Well, it certainly sounds like there's a lot of pluses to this model.
You know, Gene, we as surgeons went down and looked at all of these clinics with a real surgical eye of cleanliness and expertise, and it's very good.
There are many aspects to dental practice that if you have not been in practice yourself could very easily be missed if all one is doing is having FaceTime with dental principals and looking at diplomas. And we just felt if we were going to recommend these clinics, we wanted to know, would we send our family? And so we wanted to go down, look at the water quality that they use, how do the receptionist people deal with patients, and we just came away feeling extremely impressed and extremely confident moving forward and recommending these facilities to the people that we will be working with.
So talk about the experiences of our first client and what he was quoted by two different clinics here in New Hampshire.
Well, with Gene, our patient, his name is Joe, and he saw 2 or 3 dentists, and he was very confused about what to do. We actually escorted him down to a little town in Mexico. He embarked on a rather extensive treatment involving crowning all of his teeth, 24 crowns. And since that time, he's returned to his community. He has seen 2 local dentists, both of whom raved about the quality of his dental care.
He was really pleased, and his spouse was very pleased, and their experience was good. He had extractions and root canals, and as Steve said, many crowns, and just excellent work.
What was he quoted up here, and what did he actually pay down there in Mexico?
Right, he was quoted here in the U.S. for $52,000, and his final out-of-pocket expense, well, actually it was $19,000, and he did get some reimbursement from his dental insurance company. So overall, he wound up spending between $16,000 and $17,000 on a fee estimate of $52,000 here in the U.S. He's delighted.
Boy, that's certainly eye-opening. You mentioned insurance companies. Is there any problem with having an insurance company cover the cost of having a treatment done in Mexico?
Well, Joe found that as long as he brought the proper paperwork, which we can assist our clients with, if you bring the proper paperwork to these dental offices, they will be more than happy to complete that paperwork, just as if they were seeing a dentist here in the United States. Unfortunately, you will find, similar to you will find here in the U.S., that dental insurance does not cover a large chunk of the fee.
There's frustration with any insurance company these days. They want to put out as little money as they possibly can. And he had to work a little bit, but they did pay. And we help our clients, of course.
Okay.